Doctor, thanks for joining us. Women, a heart attack every 90 seconds. That's a kind of a frightening statistic. Are heart attack symptoms different for women than they are for men?
Yes, women are different and we are different, and heart disease in women presents in different ways, and heart disease is different in women. And women, if you look at the research and the information, most often men and women present with chest pain, and women disproportionately present with fatigue, shortness of breath, weak, just not feeling well. 40% of the overall patients, particularly women, have no chest pain. And if you, most patients think the chest pain is typical Hollywood heart attack, where you put a clenching chest discomfort and a hand across the chest, but it's only present in 50% of the patients. So woman has to be educated that majority of the patient, in 40% you don't have chest pain. You need to be aware that most often they're present with fatigue, weakness, shortness of breath, something impending, just not feeling well. Those are the symptoms women have more often than men. And even if the chest pain, it's milder and subtle compared to men. The reason is thought to be women have blockages more in the small vessel compared to the typical male pattern, which involves the big vessel blockages.
You may have answered this, but let me go ahead and ask it. For women who have had a heart attack, how do they describe it?
Most often they say they dismiss the symptoms when they have, like when they felt something unusual, fatigue, chest pains, they felt, they dismissed it and delayed the care because the chest pain was not very mild. They thought it's indigestion, and they felt weak, but they thought it could be just they ate, they didn't good night's sleep, they were working hard, and they were just busy throughout the day. So they dismissed their symptoms, delayed the care coming to the hospital, and the delay in care in heart patients can be devastating. And our key as a physician is educate the women how critical it's important to be aware of the symptoms, the subtle symptoms, and just non-specific symptoms, which are more often in women than men.
Speaking of symptoms, do the heart attack symptoms for women come on suddenly, or are there warning symptoms that could be hours or days before the attack?
As discussed earlier, women present with symptoms of heart disease 10 years later than men. And you see more women aging women in elderly population. So the women have more, have advanced age, they're not very active, multiple comorbidities. Hence, they can have silent heart attack and non-classic symptoms. As mentioned, they have more of a subtle symptoms rather than the typical clutching, chest discomfort that's described.
Is there one particular symptom or a combination of symptoms that should convince a woman she needs to get to the emergency room?
Reality-wise, any symptoms above the waist. It could be fatigue, short of breath, just a discomfort, and just unusual feeling throughout the day. That's something unusual to them. They need to get immediate attention, because these symptoms could be a manifestation of underlying coronary artery disease. If you get checked up because you have some risk factors and you feel like this could be your heart attack because of your awareness and your knowledge, get immediate medical attention. And if you're found to have not having cardiac disease, that's okay. But at least you're not having a devastating heart disease, which can be diagnosed and treated early.
Why are women so reluctant to call 911?
As we discussed earlier again, that women are do not have the classic chest pain which we always think about. They have the subtle symptom, non-classic symptoms, which they contributed to indigestion, anxiety, stress, and they delay getting medical care or going to the emergency room. And once they get the medical care, by then the heart muscle is already in the process of damage. And since the symptoms are not classic, they get delayed care, delayed treatment, which will prevent them from getting life-saving medications.
Why are so many doctors guilty of overlooking the signs of a heart attack in women?
Because physicians need to also be aware, and not many physicians are aware, that women can present with atypical symptoms, not classic, that we're used to seeing in men. They can present with fatigue, indigestion-like symptoms, just short of breath, not feeling well, we are used to seeing the classic chest pain, which might not be the presentation. And in addition, they also present late to the hospital because these women present at presentation, they have more advanced age, low level of activity. They have multiple comorbid conditions that makes them have a lot of non-classic symptoms, and they also have more myocardial damage because of delay in presentation, and so the diagnosis is missed or dismissed as indigestion or anxiety. By the time they get diagnosed, or they're already in the process of having a heart attack, and they might not be ideal candidate for life-saving therapy such as stents, balloons, or clot busting drugs.
Let's follow that thought up a little bit. A woman knows the signs, believes she's having a heart attack. She goes to the emergency room. She gets told, oh, it's probably indigestion, and is somehow in some way dismissed by the physicians there. What should she do?
Unfortunately, there's still disparity in the care because how woman presents with, because she doesn't have the worst chest pain. She might have subtle symptoms and also delay in presentation. But if the woman thinks something is going unusual and she's concerned about the heart attack, she needs to bring it to the physicians or the emergency medical services, the concern, and attempt to tell them this, she's concerned, this could be her heart attack and she wants to be tested. Need to re-emphasize, because as women can have non-classic symptoms and not all medical professions are aware of it, and that's what the job as a community, we need to increase awareness of the heart disease through education, not only the public but also the physicians.
Do you recommend in your practice that your female patients take a low-dose aspirin daily for the prevention of heart attack and heart disease?
Daily aspirin is very important for cardiovascular diseases. It reduces the heart attack, stroke, and also prevents the heart attack and stroke. Guidelines suggest women to consider aspirin, but again, before the women start taking aspirin, they need to have a discussion with the physician. They need to know what's the risk factors, the individual risk of stroke and heart attack. The more risk factors you have for having heart disease and stroke, the more benefit you get from the aspirin. So before you take aspirin, you need to have a discussion about the risks and benefits of taking aspirin. Aspirin is a blood thinner. It has downsides. It can lead to complications or bleeding. So before you start, you need to have a discussion about what your risks are, how much you can benefit from it, because each patient is different and they respond to aspirin in different ways.
What about supplements like fish oil or CoQ10?
CoQ10 is a natural substance similar to a vitamin, and it's a powerful antioxidant. Antioxidant removes free radicals. The free radicals in the body causes cell damage, cell death, cause aging. And some investigators think because of the antioxidant properties of the coenzyme Q, it can help to reduce heart-related conditions. Heart-related conditions, period. However, there is no strong evidence at this point that vitamins or supplements are going to help treat the heart condition. We still need more research and more stronger evidence before we recommend against it or for it.
Are there any downsides to taking fish oil or CoQ10?
Again, fish oil is recommended by the guidelines. Fish oil is very good for cardiovascular disease, reducing cardiovascular disease. And guidelines recommend patients without heart condition, without cardiovascular disease, consume at least 2 servings of fish, which are rich in omega-3 fatty acids. And patients with the heart disease, the recommendations are to obtain at least 1 gram of the kind of fatty acids, it's EPA and DHA, the special omega-3, through consuming fish, but there are some supplements available over the counter too. But the patient, women with the heart, need to have a discussion with the physician. The conditions where patients can have high triglycerides, it's a kind of a blood fats. If you have high triglycerides, then you're going to need higher doses of omega-3 fatty acids, about 2 to 4 grams, which needs to be consumed as capsules as recommended by the physician. Yes.
Let's bring it all together. What's your best advice to help women avoid having heart attacks?
My number 1 advice would be raising the awareness. It's critical for women to be knowledgeable about the symptoms, about the risk factors, and get prompt care when they have symptoms. Delay can be devastating in the heart disease. In addition, making healthy life choices, eating healthy, exercising daily at least 30 to 60 minutes, at minimum 4 days, but if you can do every day throughout the week would be ideal. And quit or don't start smoking. In addition, taking the prescribed medications as scheduled and taking care of the risk factors, diabetes, hypertension, cholesterol, are the best thing.
Very well. Doctor, thank you very much for your time.
Thank you.